Hello.
Uh, Hello, sir. This is Ranjita calling from Bangalore.
Yes.
Actually, I came to know about your treatment through my brother, actually. Uh, I mean, you suggest walk and rest and hydration, dehydration.
He has
Right?
started.
Uh, actually, I got severe throat pain and cough 3 weeks back.
hmm
But the cough is not reducing even after I take some syrups and medicine. I feel there is some problem with my breathing also. And
You wanted to speak for yourself, for your brother.
for me, actually, my brother suggested to talk to you, so I
Okay.
called.
Okay, but are you following one cure for all disease, or you just you're just it's just like that your brother is suggested and you're calling?
I went through your channel and got some minimum idea about what you're trying to tell. So I just followed for 2-3 days, but I'm feeling very tired actually some past 2 days. Um,
Okay. Usually, these days I am charging 1,000 rupees for personal support, and
okay.
otherwise my channel and Quora are free. So,
Mm-hmm.
but I'll just
I
recap.
can make a Google payment if you send me
Okay.
the
Okay.
mobile number.
I'll tell you about this. Tell me a few things. What is your weight?
My weight is 60 and I'm
60,
43 years. Yeah.
43 old, and what is your height?
Height is 5'5", 5.5.
Any changes in your weight in last few years?
No, from past 2 months, I feel I've gained some 2 kgs or something.
For last 2 months, you gained 2-3 kg.
Yeah, because I'm seeing some menstrual changes in me. I don't know. I think I'm going through menopause or something.
At the age of 43.
Yeah.
Okay, it will reverse
Because
that
my
also.
menstrual cycles is irregular from past 1 year.
Okay, it will regularize that. So that is one way. Now, how much water you were drinking earlier in a day?
Mm. Earlier also, I usually was not drinking much. Only when I used to feel thirsty, I used to drink.
So
Even during food also, I never used to take water.
approximately.
Morning, I used to drink 1 glass of water,
Hmm,
around 250 ml.
hmm,
In empty stomach, I used to drink.
hmm.
And after that, maybe throughout the day, another 250 or 500 ml. Yeah. In summers, it is more. Otherwise, in winters, I never used to remember drinking water. So I used to forget. Only in the morning, I used to take 1 glass of water.
How much was in summers?
Yeah, summers around 2 to 3 glass of water.
In the entire day?
Yeah.
Any other liquids like tea, coffee, or cold drinks or
Yeah,
anything?
100 ml of tea in the morning and
Hmm.
coffee. And in the evening, another 100 ml.
How do you
And
measure that 100 ml?
because I have a small cup for coffee because I can't drink too much. So I have a very small cup. It measures around 100 ml.
And
So I take coffee in that.
okay, just have a measure again. And how much is your fruit intake?
Food,
Fruit,
actually fruits,
yeah.
fruits weekly once or twice, not regular.
And what about milk intake or any other liquids?
No, milk I don't take.
Liquids? Any other liquid like South Indian food or normal food?
Yeah, sometimes during summer buttermilk,
Sometimes, not regular.
sometimes not regular.
And do you get pain during periods?
No, no pain.
And these are irregular only for the last 1 year.
Yeah,
And before that,
yeah. Before that it was okay. I mean, every month I used to get. May not be exactly 28 days,
how many days?
but every month I used to get.
How many plus minus days?
Usually it was getting delayed by 2 to 3 days.
By 2-3 days.
Yeah.
And 4
I
days.
mean, this month, if I get it on 28th, I might get it on 30th or 31st next month. Like that.
So that means about 4 days. If you consider 28 to be the right cycle. So about 3-4 days or 5 days. 3 to 5 days.
Yeah, 3 to 5 days.
And no pain, you're saying never?
Yeah. Not much pain. Only first day I used to feel some cramp, very minimum.
But you never taken any painkillers?
No, never.
Have you been on any medication for more than 7 days at any time in your life?
Yeah, last year when this menstrual cycle was irregular, my gynec gave me some progesterone tablet hormones to initiate the cycle.
No, otherwise,
Then my taken time.
Besides that? Besides these tablets, any other medication?
I don't think so. No.
So not more than 7 days, ever?
Yeah, and last year I had some severe throat pain, then I had taken antibiotics.
For more than 7 days?
No, not more than whatever the antibiotic dosage, 5 days I think.
Okay. Now tell me about your meal size. When is the time when you eat and what is the size of the meal?
Usually morning around 10 o'clock I'll have my breakfast. Ours is like more of rice diet, rice and millets.
Rice and millets?
Yeah.
Where do you take millets? That's not conventional.
Millets we started around 2 years back. My husband was a little bit diabetic, so we started millets and his sugar came to normal.
That's temporary only. That is not the solution for diabetes. Anyway, we come to that later. Now, looking at, meal size. Leave aside these 2 years. What was the meal size before 2 years?
It's almost the same, sir.
Like size. Size means how much? How much do you eat? Have you ever eaten chapati, roti?
Yeah, chapatis we occasionally we make during the night time. 3 chapatis we have if we prepare chapatis.
So normally in one meal you will have 3 chapatis.
Yeah.
So we can say the similar kind of thing for rice and other things.
Yeah. I mean, we don't calculate how much we eat. Like until I am full and satiated, I eat and then stop it.
Yeah, that's right. But if you consider people of your age and your weight and height, you eat normal.
Yeah.
Okay, you were telling about time. So one is 10 o'clock breakfast.
And 10 o'clock, yeah. And afternoon around 2. And evening again 7:38. Sometimes if my husband comes late, it will be like 9 o'clock.
But normally about 8.
Yeah, around 8 o'clock.
8, 2 and 10. Okay. And what is the possibility of preponing your breakfast?
Come again, sir. I didn't get you.
What is the possibility of preponing the breakfast to 8 o'clock, 8 to 8:30?
Okay, I can do that. Sir.
You can do that.
Yeah.
Okay. Now you said that you've been following something for the last 2 days. So what is that you have been following?
Yeah, my brother asked me not to drink water throughout the day. Only during meals, just have a glass of water with the food.
Okay.
And walk and rest for 5 minutes walk and 5 minutes rest for around 15 times per day.
So you've been doing that also for the last 2 days?
Yeah, from past 2 days.
And you felt tired?
Yeah. From yesterday, I'm feeling a little tired and yeah.
What about your bowel movements?
Yeah, that is normal. And
These
it is
2 days
started
also,
now. Huh.
you felt any better?
No, I didn't find any difference as such because I
Uh,
was already
okay.
without any difficulty. I was passing the
And
time.
what about your sleep quality?
Yeah, from past 2 months since this period problem started, I'm not able to sleep properly.
What about for the last 2 days?
Yeah, yesterday I slept well.
Hmm.
Yeah.
What about your intake of carbohydrates or say sugar, direct sugar, sweets?
I don't like sweets much, so only in coffee tea I take one. And that's all. Otherwise, occasionally if somebody gets home some sweets, then I take
So
something.
occasionally would mean once in a month or so, or more often?
Sweets, huh? Maybe, yeah.
Once in a month.
Mm.
No ice cream, nothing.
No. Ice cream also occasionally during summer. If there's a family get together or something and everybody has,
What is the
I like to
frequency?
take.
Once in a month or twice in a month or more than that?
Yeah, maybe 2-3 times a month. Is it?
And quantity is less or it is too much like brick kind of thing?
Sweets, huh?
Yeah, sweets or ice cream.
Yes, quantity is small only. One piece of sweet or
Okay.
cup of.
Now consider again you are taking one glass of water on empty stomach and almost no water for rest of the day except for another 250 or 500 ml.
Yeah,
And besides that 100 ml of coffee 2 times in a day.
yeah.
No other fluid or no other fruits or
Mm-hmm.
anything regular on regular basis.
No, contact.
Uh, like, can you recall, like, was there any change in the urine output in the last 2 days? How many times frequency? How many times you passed urine yesterday and day before while you were doing walk and rest? Did it increase or no?
Yeah, the quantity was reduced because I forcibly controlled water. So,
No, but how did you control water? You take 3 meals and you took 3 glasses, and otherwise also you took take 3 glasses only. So there is no change.
the quantity of water in the glass I reduced actually.
To how much?
Only that 100 and that small glass of which I drink coffee, I
Okay,
drink in that. Earlier I used to take in big glass of water,
okay.
around 250 ml I think. I used to take.
So, but number of times you went to the loo for passing urine? Number of times, not the quantity.
Mm, um, maybe twice or thrice a day.
These 2 days.
Yeah.
And
Earlier
earlier,
also I didn't see any change in the frequency of
okay.
urination.
Take 150 ml of water every hour for next 3 days.
Okay.
Your urine frequency should increase within, whenever it increases, just focus on, like, if you can note down somewhere, try to note how many times you pass urine. And the target should be to urinate more than 10 to 12 times. Only for
Okay.
limited period of time, only for a few days.
Okay.
So, you seem to be kind of, you can say whatever hydration or dehydration, but there is an imbalance.
Mm-hmm.
So, first of all, you increase your water intake, and the more important thing is not how much water you drink, but the frequency of water intake. It should be once every hour, and
Okay.
restricting the fluid intake to 150 ml in one time. So, about 15
Okay.
times
Every hour in the sense during the daytime till
during
I'm
the
awake.
daytime. Yes.
Okay.
And it will be close to 15 times, and
Mm-hmm.
15 into 150 will be only 2.25 liters.
Okay.
So that should
Okay.
be doable kind of thing, right?
Yeah. Okay. And
Walk
this
and
walk and rest also I should continue.
you continue work and rest. In case you're feeling too much fatigue or tired, you can reduce it to about 12 times in a day instead of 15 times, or you can keep it anything between 12 to 15 times, but you must do it.
Mm-hmm. Okay.
For rest, are you lying down in bed or you just sitting?
I lie down on bed, sir. I stay at home,
That's
so
okay.
I'm able to lie down.
Yeah, that's better. So, so meals timings also you change to 8 to 8.
Okay.
So there is 6 hours gap in this also.
But I don't feel hungry, no, sir. I don't feel like eating these days. From past
Uh,
couple of days.
Sorry.
From past a couple of months, I'm not feeling hungry.
See, as I am saying, all of your health problems will get resolved. You will not hit menopause for the next 10 years.
Okay.
You will not have irregular periods also. Maybe within 2-3 months it will be regularized and it will be close to 28 days only, not even 29 or 27 days.
That would be very nice, actually.
And besides this, you can expect to lose 4-5 kg weight also over a period of 2-3 months from now.
Okay.
And as you mentioned that you are having problem for the last 2 months or so for with the sleep, that will also improve, and mood swings and all that which happen due to menopause will
Yeah.
also not be there. It will reduce considerably within 10-15 days.
Okay.
And
That is
this,
good news because I'm finding it very difficult to do my daily chores also.
yeah, I
That I
understand
feel
that part. And
motivated.
another thing is that this 1,000 rupees which I said is for full 1 month, so you can call whenever you feel like having any
Okay.
issues. Okay.
Okay. Okay.
Now coming back to you called for
Cough, actually.
cough. Okay. So you increase your fluid intake and just watch what, and don't take any syrups or any medicines.
Okay. Yeah, I've stopped taking any
Yeah,
medicines.
and
I
blow.
got,
Hmm?
yeah, I got frustrated taking medicines and
Yeah,
I stopped
and
that.
try to clear your throat by blowing out your nose or by coughing out as frequently as possible, almost every hour, at least once every hour.
Yeah, I try, sir, but nothing comes out.
So, but
I
you,
feel something is stuck low,
yeah, I
below
understand.
the throat.
But your problem is your fluid intake is erratic and low.
Mm-hmm.
So once you increase it and then you reduce it, so
Okay.
there will be some kind of balancing in the fluid compartments in the body, and the things will move in the right direction.
Okay. So this increased water that you told to take every hour, how many days should I follow this?
See, that will depend on how many times you pass the urine. In case on the first day itself your frequency to pass urine increases to 12-15 times, you can stop
Okay.
after 1 day itself.
Okay.
If
Okay.
it does not stop, then you can continue. When was your last period?
Now it's because I took the medicine, as I told you, as soon as I took the medicine she gave, I started getting my periods, but the flow is so less, it is happening from past 10 days.
It is happening for the last 10 days continuously.
Yeah, and but the amount of blood is very less.
Okay, and you stop that medicine also. There is no need for medicines. Medicines do
Yeah, I took
nothing.
only for a day and I stopped actually.
Okay,
My
now when you
bleeding
start
started.
taking this water, whatever
Mm-hmm.
is the small or less bleeding you are getting, that should stop within 24 hours, or you continue almost 24 to 36 hours till this bleeding stops completely.
Come again, sir. I have to follow this 1 hour water taking for 3 days.
Not for 3 days exactly, till your bleeding stops.
Stop. Okay.
That should happen within 24 to 36 hours.
Okay. Okay.
If it does not happen, just give me a call. The target is that by like today it is already 10:40. Okay, it's the beginning of the day. So most likely by tomorrow morning, depending on your urine output, hopefully the things should move in the right direction, and today itself the urine output should increase. So by tomorrow, in case everything goes fine, you are supposed to dehydrate completely. No fluid intake, no tea, no coffee, no water, and regular 3 meals.
Regular 3 meals and water, 200 ml of water with that.
No, nothing. Not even with the meals.
No water at all.
Yeah. But that will depend on the frequency of urination. In case it is not happening, then continue 1 hour water intake tomorrow as well, and this dehydration will take place day after.
Okay.
So it's better you
and
give me a call tomorrow.
How many?
Hmm?
And that dehydration, how many days should I continue?
Only for 1 day.
Okay.
And better would be that you give me a feedback by end of the day or tomorrow morning.
Okay.
And I would suggest you, in case your husband was diabetic, and he's been diabetic for a few years, or how much time?
Yeah, maybe 1 or 2 years, I think.
So there's no need of millets and all that, and no need to restrict the intake of carbs or sugar also. He should be free to eat anything or drink anything. Not anything, but once he starts following this thing within 15-20 days or maximum 1 month, he should be free of diabetes for life.
Okay.
Millets and all that is a temporary thing.
Walk and resting and
Hydration, dehydration. And
because
it's very.
I think he takes lot of water. What I have seen.
Yeah, usually that is the problem. 90% of the cases, the fluid intake is more. But in your case, it happens the other way around.
Okay.
So hopefully things will get better. Your cold and cough may continue for 7 to 10 days.
Okay.
But after 7-10 days, you should be like your chest should be as clean as glass, and so far as your respiratory system is concerned, it should be in perfect shape, and you should not get any cold and cough for the next few years.
Okay. And one thing I notified, sir, if I can discuss that with you.
Yeah.
When I took the second dose of vaccination, then I got this cough kind of a thing last year, and again it's repeating after that. I don't know whether I should link it with that or.
Maybe just a coincidence, or basically.
I never used to get cough like this so long. The second time it's happening.
So could be related also, because vaccination does nothing except kind of introducing a virus in your body. They claim it is dead virus, but the claim of dead or alive is something which is debatable.
Yeah.
So anyway, that will hardly matter whether you have any issue or not. This takes care of every situation. So I would be interested in working out, making sure everything is cleared up. Not just one thing. Every health aspect should be perfectly fine within less than 1 month.
Okay. Thank you. And one more thing. I haven't had my breakfast till now. So today, can I have it now? And
yeah, you have it now, and delay the lunch by another 1 hour or so.
Okay.
And you can pay the amount on this number itself.
Yeah, this same number I can do.
Yeah. Okay. Thank you.